The other week on LinkedIn, I saw this lady post about how her surgical team had allowed her to wear her Oura Ring during her surgery. You will not be surprised to know that after the surgery, the message she received was that she'd had a really good sleep. Something which I'm sure, had she asked the anaesthetist, she would have been told anyways. And so I think it's a great summary of exactly where we are when it comes to women's health technology. And so today I'm going to answer the questions that nobody else in health tech seems to want to. Should I be reassured that my health app has more data on me than my GP? I'm hearing this one so much at the minute. Every single product within health tech seems to be sort of cushioned around this idea that we're not replacing your doctor, but ... There's a very strong implication that AI and new technology is going to replace your doctor, but I'm going to show you the ways in which this is very likely to be untrue. So the first thing is that period apps have been collecting women's health data for well over a decade. And if you're a woman and you've accessed healthcare, please do put in the comments, do you think that healthcare has improved in the last 10 years? My answer to that simply is no. And the reason is they've collected all of this data, but what they've done is very little with it. Yes, they've shared with sales and marketing teams, they've shared with legal teams, they've even shared with insurance companies and possibly even employers. But here's who they haven't shared it with. They have not shared it with medical clinics, medical institutions. They have not done large-scale studies of in-depth research that could really move the needle when it comes to women's health. Essentially, the volume of data does not necessarily mean a greater volume of insights, and it also doesn't mean better women's health outcomes. And one of the difficulties and the tensions between health technology and mainstream medicine is that for those of us who've come from mainstream medicine, our outcomes are always about, has this woman's life improved? Have her symptoms improved? Has her overall health improved? We're very much looking at individual health outcomes, but also population health outcomes. Can we improve the lives of millions of women all over the world? Within health technology, the metrics are different. It's number of downloads, number of users, number of products sold, and that is where the discrepancy lies. So ultimately, it's not to do with your app has more data than what your GP has. It's about how is the information used. If you've been over onto my platform, SheRanked, you will see that that is where myself and the rest of the SheRanked team have gone on and we've reviewed women's health apps. When we say we've reviewed them, we stuck them through our rigorous scientific framework to look at, are apps providing medically accurate information? Is the data protected? Are women's privacy maintained? Is it user accessible for women from all different sorts of backgrounds? Is it ethically built, or is it hiding sneaky little paywalls in hidden places, or dealing with sensitive topics in a not so sensitive way? And we also look at what is the long-term behavioural impact of these apps on any woman that chooses to use it. If you're not sure which app to trust, then do pop over to SheRanked.com and come back and tell me about it. I'd love your feedback. Next question, why does Femtech or women's health technology keep using women's bad experiences of mainstream healthcare to sell products? I love this question, and it's one of the things that's not really spoken about, but is definitely happening. For as long as we know, women have been excluded within medical research. We know a lot of the things that we know about the human body really have been built around what we know about men, and it's been applied to women rather than doing that true research around women's physiology. I know as a woman and a doctor that so many of you come into clinics and have felt dismissed, that you haven't been believed, that your symptoms haven't been taken seriously, and the majority of women have had poor experiences of healthcare at some point, myself included. And so this is actually something that, yes, it needs to be in the public domain and it needs to be talked about, but the other side of the coin is that it's also serving a narrative within the world. And that narrative is that mainstream healthcare is bad, it's not to be trusted, and that women are being dismissed, and therefore health technology is the saviour of the day. We're filling the gaps that mainstream healthcare couldn't fill. The problem with this is that many of the healthcare products that are on the market are from female founders who've had a poor experience and they've built a product based on their experience. A lot of their story around that product is based on one person's experience, and it's based on marketing, and it's not based on evidence. It's not based on treating thousands of women, and that's where it becomes a real difficulty. Almost every founder within Femtech has got a personal story when it comes to healthcare. I've certainly had many that I could share, and I think it's really valid to give those people a platform to express their experiences, and those experiences should be there to support other women who are going through the same thing. But that is not the same as clinical evidence. What works for one woman and their experience does not necessarily translate to every other woman. And so whilst people can be giving advice based on their personal experience and what they believe to be best, that doesn't mean that it would fit every other woman who's dealing with that health condition. And that's where we come across real difficulties within women's health technology. And the other thing is that it's incredibly easy to criticise mainstream healthcare when you carry zero responsibility for the health outcomes of other people, or worse still, life and death outcomes. When apps and other platforms are pushing forward their solutions, most of them do not carry the same weight or responsibility for your health. So for example, in 2025, we saw that lives had been affected by wrong information that was given by platforms like ChatGPT. That wrong information is also hugely within women's health apps, and we know that from having reviewed hundreds of them. Many of them provide information for women about their bodies and their health that haven't been verified by medical professionals. And that also means that women are paying for a service from a provider that then will take no responsibility if things go wrong. And they can do it because the majority of apps have a medical disclaimer, this is not medical advice and therefore go and see your doctor. The problem with that is, in many cases where they're not providing a solution, they're actually adding to the problem, because in some instances, wrong information can delay access to really important care. I actually saw a post this week on LinkedIn where a founder was saying, I'm not from a healthcare background, and because I'm not a doctor, I didn't think I had anything to bring to health tech. But I now realise, because I've sold whatever product it was, that all I needed was confidence. That should concern all of us, because it very clearly shows that people do not know the boundary within what is giving general wellness advice and what is stepping into medicine, what is stepping out of your remit, and a lack of understanding of just how complex women's health truly is. The same system that has left a lot of women feeling very dismissed and very frustrated, underdiagnosed and under-researched has also been the same system that's saved millions of lives of women. And I'm thinking specifically about things like cervical screening, for example. Yeah, it's so grim, isn't it? It's so uncomfortable. But actually, if you were to ask me, with both my hat on as a woman and my hat as a doctor, what I think about cervical screening, I'd far rather go through a few moments of discomfort to get a smear test back that says that I am at low risk of cervical cancer than to miss out on that. What's interesting is the speculum got such a bad press in 2025. It was like every woman wanted to complain about the use of the speculum as this sort of torturous device, but many of the devices within medicine were created round about the world wars when they were needed. And so things have not progressed, and yes, there does need to be more research, but I've also looked at the newer speculums that have come onto the market, and quite honestly, they look just as torturous. And so I would just really encourage you, if there are gynae procedures that make you incredibly uncomfortable, do speak about the pain, the discomfort. If you've got a history of it, let's go with adequate pain relief and making sure we get these tests, then avoiding the tests and having very sinister outcomes. When I built SheRanked, it was very clear to me that I was at an advantage from having treated hundreds and thousands of women. Our framework isn't just built on one doctor's experience of women's health. We also embed the feedback and voices of many, many women who've used various apps. Next question, who owns your health data and what's it been used for? This is going to be one of the biggest questions within women's health technology. There is a gross understanding within health tech about the right to people's health information. Now, from a medical background, one of the greatest privileges that I have is that I get to speak to people about their most intimate health details, and that is confidentiality. That is one of the privileges of being a doctor. It is why we try our best, don't always get it right, to be rigorous with people's personal medical information. There is something within health technology where it's a bit like people within tech have had access to personal information, so your name, your date of birth, your address, your email address, etc. And they now feel like they are entitled to your health information, which is simply not the case. And I actually think that there should be much more done to protect people's health information. One of the riskiest times in terms of your health information is when you first download an app. So within those first few moments, there's usually a load of sliding buttons. You've just paid whatever you've paid, £7 for the app, and they will take you through a load of buttons. Those buttons are deliberately put in that onboarding process to get you to say yes to everything so that they can have access to your information. It's a marketing ploy. And so there'll even be things in there asking you, do you want to take part in research to help women's health? 10 years of collecting women's health information. They haven't done a lot of research, and I can tell you that from looking at hundreds of apps. There is something within health technology where they feel like they're entitled to your health data. That is why we are now beginning to see big players within technology in general, so Meta, Google, Facebook, YouTube, dare I say, all in the public eye for just not making very good or ethical decisions when it comes to people's information. And it's essentially because the heads of technology feel that they are entitled to it. And why do they want to be entitled to it? Because the data sells. It's huge money. And your health data is so much more valuable than general sort of personal information. They're now trying to penetrate into emails to get your information, and it's all to sell products. It's all about money generation. And that's where technology and health technology and medicine coincide. Now, maybe if you live in the United States, where the setup for access to hospitals and insurance is different from the UK, I understand that medicine and money go hand in hand in the United States, but that is not yet the case in the UK. We very much go on a salaried job as a doctor, go in and provide a service. We don't get paid more for recommending a drug or anything like that. It's just we do the best with the guidance that we've got. And so there is this discrepancy within health technology to get access to your health data to sell it, and within medicine to protect and respect people's choices and their confidentiality. When I say that women's health technology is a $75 billion industry, what am I saying? I'm saying that is money generated by your data, which is huge. The app Clue reported that they've collected 2.2 million women's data. Flow was all over the news in 2025, along with Meta and Google for possibly misusing women's health information, and they settled out of court. But Meta's been back in, and I think we're just scratching the surface of the ways in which people's information and soon their identity is going to be misused. One of the biggest trends within health technology at the moment is that many providers are talking about end-to-end data. So taking user data, so from you, from your app, and taking it through every step so it links then into a health provider. Now that sounds very good, but every time your data exchange hands, then there's a different privacy policy. The privacy policies are designed to be confusing. They know that women do not read them. And what's happening is the information is being passed on. That is all for commercial gain. And even if it taps into a healthcare provider at the end, again, there's a financial gain. Now for you, you may not be bothered about this. You may be somebody's like, I don't really care how much money they're making. But I think as time goes on, the repercussions of this are really going to come to pass. And yes, maybe them making money off your information isn't a big problem, but when you think of who they're selling it to, it's not just sales and advertising. It can be legal teams and government, particularly if you're in the USA, but could soon be Europe, and also employers potentially, or insurance companies. That has huge implications on your life and on your health. Do wearable devices actually work for women, or were they just trained around male physiology as well? Loads of wearable devices were initially trained on male data, and they just collected data. Really, they weren't doing anything meaningful with it. Increasingly, we are seeing products that are produced that are just collecting women's information, which is great. You know, we're starting to track things like your cycle, your sleep, hormones. I've seen a lot of hormone trackers advancing over the last few years. And so that's great. But what hasn't improved massively is the predictions are still not particularly accurate. And also, women aren't really guided on what to do with all of this information. I think, you know, maybe as doctors, we're slightly underwhelmed by it all because they aren't really telling us anything that adds a lot of value about your health. But in actual fact, women initially are always quite interested in, oh, my heart rate is this, and I slept 8 hours last night, or, you know, it's saying I've had really good sleep. I think initially they see the benefit of just having a bit more insight into their body, but the reality is they're monitoring a lot of things that you don't actually need to monitor. That would be the first thing. And so what we see in general practice and in the emergency room is that something started beeping and it looks a bit off. So women are rushing in, but in actual fact, within the normal population, every once in a while your body will do something like that. It doesn't mean that it's the whole system is going off, but many of these devices don't provide the support to interpret the results. Certainly within medicine, we talk much more about trends over time rather than single readings. So for example, if you've ever gotten to your GP about a blood pressure, they'll very rarely take one blood pressure reading and say, oh, you've now got high blood pressure, let's treat it. We always look at it over a period of time. Now, these tracking devices and wearables are becoming more sophisticated. And for things like hormones, we don't have the same hormone cycle as men. And so, yes, it can be potentially good to look at them, the hormones changing through the month. But the question that I would ask is, what value is that given to you? Like, what is it making you? Are you doing something different? Do you just like to know? Just check what value a wearable device is really giving to you, because in many instances they're tracking a load of things which you don't actually need, but they'll be able to sell. Do you know, the other thing I think when it comes to wearable devices is there's a reason why they're trying to make them look trendy, like, oh, this is the latest gold ring and it looks really chic, and oh, it's now in an earring. And, you know, from a tech point of view, the challenge has been to take something scientific and make it look glamorous and like you wouldn't know it was there. But as a doctor, it feels incredibly gimmicky. It's like another thing just to sell. And I understand it when it comes to things like, for example, a good sports watch, where you've maybe got a training plan, you're looking at your heart rate and you're monitoring that, or, you know, there's distances mapped out, or there's prompts, like a lot of those things which are very proactive and supporting you in behavioural change. That I can understand. But for things like, oh no, I've got earrings that are going to tell me my heart rate, as a doctor and as a woman, I just don't think that that adds any value, unless I was particularly feeling unwell, in which case I would probably just record my own heart rate. But I think that it's causing a lot of confusion for women, and I'm yet to see improved health outcomes as a result. And on top of it, these wearable devices cost a lot of money, and you often, if you have the device, then have to pay for an app on top or a subscription. And I just sort of wonder, what exactly are you paying for? Next question, when it comes to health technology and apps, like, where is the research and who's paying for it? So this is the question I love. I get it a lot. I actually get it from women who are particularly geeky when it comes to medical research and they want to know what's happening, research in that space. Or I get it from women who've been working within health research who are now looking at health technology and wondering, well, where is the research within it? And it's a really good question. Many of the biggest apps, like Flow, for example, has been clearly recording and sharing your information for a long period of time, definitely over a decade. They linked up with the Mayo Clinic, and you'd think, well, this is great. They're going to produce some research that's going to really push women's health forward because they've got all of this information they've been collecting. What did they do? They did a survey And if you know anything about research, you will know survey is pretty much the bottom of the scale when it comes to research. So a really, really disappointing display. At the same time, Clue, which collected 2.2 women's menstrual data, have started to team up and started to do some research, which is really good. But one of the places that they teamed up with is MIT, which again, not really medical, it's much more data science. And they're producing a population study on, let me see, was it endometriosis? Was it heavy periods? Was it irregular periods? No, it was to do with whether or not pollution in the air can affect your period. I'm yet to have a woman who's come to me grossly concerned about that. But it does highlight the point here that much of the research within health apps, so if you see an app saying, you know, we've got a 98% success rate, that research has been done by the app itself. Anyone in mainstream medicine knows that it's incredibly hard to get funding for genuinely good medical research. And on top of that, you've got to go through ethical boards, there's medical boards, it's got to be approved. The research has got to be tested before it's funded. Like, there are so many hoops to jump through, whereas apps are collecting information because you've pushed a toggle on their screen and they can collect this information from you, which they will use to produce research that essentially is by the app, for the app, and paid by the app. One of the things I think is so interesting though is that there are new apps coming onto the market. So I know there's those famous ones that you've all heard of, you've probably tried it at some point, but there are newer apps coming on the market and they're building in a super smart way. These are often founders that have come from research backgrounds, so maybe they've researched something like pelvic health in great detail. They have the evidence already, and now they're building an app to facilitate that right the way through. So I certainly know of one that's building within pelvic health, and it's taking it from basics all through a woman's life, essentially. Now that is a really important space and something that's worth watching. So yes, historically, research within apps hasn't been good. It's paid for by the app. It's not independent and it's not particularly reliable, but we're seeing that that tide is turning, and that's exciting. So the next question is, what should you actually look for before you download a women's health app? This one is so important. Do not be fooled by doctor approved, research-based, anything where you cannot find information easily about who's made the app and why they've made it. Unfortunately, platforms like Google Play Store or the Apple Store will only tell you what users have said, and sometimes if an app's been free, somebody will just give it 5 stars because it was free. You need to know, 1, is it medically safe? 2, does it protect your data? 3, is it accessible to all users? Maybe you have specific requirements. Does it cater towards your requirements? 4, is it ethically built? I know for so many young women, they really have been mistreated within healthcare, and many of these tech companies have also been unethical in terms of how they've built their product. They've built something to sell, and so just check, you know, what has been considered, how are they using your information, and how are they dealing with sensitive topics, for example. Check if it's been ethically made. And the final one is, what is the behavioural impact? Is this something that's genuinely going to improve your understanding of your body? Maybe you want to understand your hormones a bit more. Maybe you want to track your periods and that's enough for you. Does it give you a nice summary report of that? Or is it something that's going to make you anxious if you miss a day of tracking? Is it going to predict your ovulation window accurately? Is it something that's going to make you stress-free or anxious? SheRanked framework basically pulls all of this information into one place. It's to make it super easy for you to make an informed decision. We don't tell you, use this app, don't use that app. What we do is we have pulled all of those key bits of information into one place, so you can just click on, you can read it, and you can make a decision for yourself, because women should be able to make informed decisions about their health. Love this question. Are menopause apps worth it, or is this just the menopause gold rush? Yes, many women have struggled through menopause. Access to information about menopause can be really poor, and perimenopause, which is frequently diagnosed as something else, maybe anxiety or a mental health condition. And so women within that menopause and perimenopause space feel very, very underserved, and they are. That's the first thing to acknowledge. They have been and they are underserved. But what that also means is there's now a rush within health tech to create platforms for perimenopause and menopause. And in actual fact, they're not really offering much more other than a symptom tracking tool and maybe some more information about menopause, if that information is even worth reading. And so what it also is doing, you won't be surprised to learn, is collecting all of your information on perimenopause and menopause. Again, these are large data sets that apps can then sell to various institutions to make a lot of money. Now, you'll know if you've watched previous content of mine that things like your menstrual data can be worth anywhere from $10 onwards per use. And if you put together 2.2 million women's data, you can see that's a lot of money. When it comes to pregnancy, that value can be 200 times that, because they know pregnant ladies are going to spend. And so I would put perimenopause and menopause in a very similar bracket, where as women, we're sort of just desperate for support and for help and for information. We want to understand our bodies more. And if an app's promising to track it, or, you know, record your symptoms here, they'll probably charge you some sort of monthly subscription. So they're making money off you, but they're also harvesting your data. And so it's really important to recognize that they're not necessarily offering you symptom management, treatment, or a better outcome. They're just collecting at this stage. So just be careful of anything that's dressing itself up as a perimenopause or menopause app, because the chances are it's not delivering you a solution, but it is taking your money. Now, the other thing is there may be some apps around perimenopause and menopause that are actually integrating with specific clinics that specialize in that. So I definitely know of one in the UK, which is Balance app. Balance app we've actually reviewed, and I will include a link below. It scored really very good. You will not be surprised that Balance app is affiliated with Dr Louise Newson's clinic in the UK, and she specialises in menopause and perimenopause care. And so apps like that, where there is that clinical oversight and there is the ability to tap into a medical provider, can actually be very valuable, but you just need to know how to distinguish one from the other. Tracking hot flashes and disrupted sleep can be useful, but only if they show you how to use that information. Otherwise, they're just plotting what looks like anxiety on a graph. And so all of the best app providers will be signposting you either a summary of what to bring to see your health provider, or they'll be linking you directly with the health provider. Because really, for perimenopause and menopausal care, you really do need specialist input. Is AI in women's health tech genuinely useful? This is a huge question. AI definitely has its advantages, and I think it will continue to do so. I think it's a good place to find a framework or an overview of something, or, you know, even put your symptoms in and see what it says. But I think the problem is where people actually trust the output of what AI is generating. Many women's health apps are pushing towards this sort of AI health coach or AI chatbot, this idea that you're getting some sort of personal input or medical advice without having to see a medical practitioner. Now, what's interesting about this is much of the marketing around it is, we're not replacing your doctor, but ... And there's an implication that they sort of are. They're somehow helping you in some way, or they're detecting something that your doctor wouldn't detect. And they're not your doctor, but really, in brackets, if they could hide what they were really thinking, they would say, but we'll take your money and we'll hide behind a medical disclaimer, because it's a bit like they want the access to your information. They want you to trust them, they want you to pay for the service, but they don't want the responsibility of anything if it goes wrong. And I think we're already seeing that within AI in general, with ChatGPT prompts causing harm. You know, large tech companies like Meta not really looking out for young people, children, women. And I think that the AI space for women's health has the potential to do the same. And I also know from working with various other professionals within health technology, there's some amazing firms that are working very hard to put in this clinical safety layer into AI. What does that mean? Well, it means that if they analyze, for example, your chat in a health chatbot, that they can see things in the conversation that are essentially, as doctors, what we call red flags, things that mean you need to see a specialist or a healthcare provider, or they're going to flag a safety concern. And so they're actively working on that safety layer. Now, I think that that has got a real potential to help us in the future. But for the time being, there are two areas that I would never trust AI with. One is my health. Any sort of health information, it's a no from me. I won't be trusting it until such times as those safety layers are in and they've got some sort of proven validation. And then number two is I wouldn't trust them with anything to do with making decisions about my data privacy, particularly health data privacy, because AI does not have that level of complexity or understanding yet to be basing your decisions on. I also know that from speaking to legal teams around privacy policies to do with women's health apps. So two things: do not trust AI at this moment with any health decisions or any legal decisions. So what does a good health app actually look like? After everything we talked about today, I think it's very easy to get stuck on the negative things and the safety things and everything that's going wrong within health technology. And you're right to be prudent, because at the moment, the safety mechanisms are not there to keep you safe. And so you need to be keeping yourself safe. And we're obviously working very hard at SheRanked to keep you safe as well. But there are good apps out there, and here's how they look. They make their privacy policies simple to read. So yes, you might be able to click on a link and find, the detailed legal privacy policy, but above it, they've written a little summary of all the bits you want to know. For example, you are in control of what we do with your data. We only store your data if it's essential and we'll let you know, or your data can be kept on your own device. Whatever it is, they can state it in a very clear, simple way above their privacy policy. Number two, you can find the information you need about it before you download it. It used to be you would just click on it, you'd look at the number of downloads, the number of users, and you think, oh, well, look, all of these people thought it was 5 stars. You don't have to risk that anymore. You can find out, you can check platforms like SheRanked to find out, is this safe or is it not, or at least pull the information together that you need. It should be easy to find. And actually within our reviews, one of the things we say is, for example, this app scored low because we couldn't find the information to make an informed decision. And so there are already clues in there in terms of how easy it is to find the information within our reviews. Medical information, they should have named professionals and some details about what those professionals do. For example, they used to be able to say, this doctor approved or OBGYN approved. Now they should say, for example, Dr. Louise Newson associated with Balance Menopause app. So you should be able to find a named professional. And if you click on her website, you'll also have, a list of her credentials, like her medical credentials. And that's how it should sort of link in. And on top of that, it's also really a good example because it shows that the app isn't just giving out information, it's signposting you back into a healthcare provider. It also is easy to find their data privacy policies, etc. So these are just simple ways that apps can move forward into this gold standard level of health app, which is what we're trying to build at SheRanked. Another thing that they can do is build research into the app. So yes, apps funding their own research isn't good, but there is a process within medicine called peer-reviewed research, which means you get somebody external to come in and make assessments with the information. That's much higher up in terms of the scientific scale of how good a quality piece of research is. And so it's really important that apps go into that independent peer-reviewed research phase. Or what we're saying is that they've often done the research before they've built the app. So I think we're going to see many, many more like that. And they're the real contenders within the health technology space moving forward. So yes, there are great apps out there. We're really happy to try and find them and highlight them for you at SheRanked.com. I'd also say if you're a developer and you're wanting to build something that's genuinely good within women's health technology, we're here for you. You're the type of people that we work with, we build with you, we help to make it simple for you to create something that women can genuinely use and can genuinely trust. So reach out. Just to summarise then, women's health technology is not the enemy, but it is seriously lacking in accountability. Medical gaslighting has been going on for centuries, really, when you think about it. We'll go with decades if we're being less dramatic. But whilst health technology is making promises of improvement, they need to show that by showing the same level of accountability and undergoing the same level of scrutiny. Health technology has relied on selling products and really good marketing, but marketing is not the same as medicine. And so those two need to meet somewhere in the middle to really push things forward when it comes to women's health. The good news is that better does exist, and it's becoming more and more common, and that is something that is super excited within this space. We are continuing to develop what we're offering at SheRanked, which is free access to women all over the world to our app reviews so that you can find health tools that you can trust. We are expanding all the time. We welcome your feedback. We are free for you to use. Every week as well, I drop the download, which is my newsletter, where we talk about one app in really super simple language and it goes straight to your inbox. So come and be a part of the SheRanked community. We're working so hard to build this mission of improving women's health, but also keeping women safe and protected for the future. Hope it helps.